To the health sector now, and management of the Ridge Hospital has recruited 15 doctors and other professionals to begin work on the renovated hospital. Medical director of the hospital, Dr. Thomas Anaba, said they have also concluded agreements with the Ghana Health Service to recruit foreign doctors and pathologists to work in the new facility.
Renovation on the Ridge Hospital began in 2014. Government secured $250 million from development partners to work on the facility. The new facility was scheduled to be opened in January this year, but has been deferred to March. Currently, over 1,000 equipment have been secured while awaiting training of staff. Already, some staff have been trained on how calibration is done on some of the equipment. Management of the hospital has recruited 15 doctors and specialists to help run the facility. Again, it has concluded agreement with the Ghana Health Service to deploy foreign doctors to assist them. Medical director of the hospital, Dr. Thomas Anaba, said more than 100 nurses have also been deployed.
We have the support of the Ghana Health Service. They are posting a lot of nurses to us. But even now, even midwives, we wanted 100. Now we are around 110. It means they have listened to our advice, because the human resource strategic plan that was created for this new hospital, they were part of it.
Of major concern to the management of the hospital is how to maintain the newly refurbished facility. It has therefore tabled a proposal to the Ghana Health Service to increase OPD fees to about 50 cedis. Dr. Thomas Anaba was elated the facility would commence in earnest to provide adequate health care.
We thought it wise that we should emboss all the equipment before we move in. That is what we've done in the other 4 buildings that we've taken over. And now they have started embossing the equipment in the main building. This is to prevent theft and to be able to account and do quick inventory about any of the equipment.
The ultra-modern 420-bed capacity hospital is to improve quality and expand access to healthcare delivery, particularly to its immediate catchment area.
Will the poor be able to access healthcare at Ridge Hospital after government provided over $250 million to help revive and renovate the hospital? Authorities at the hospital are proposing the need for government to revive the National Health Insurance Scheme to be able to provide enough funds for them to maintain the lifespan of the hospital. How prompt and fast will government listen to the demands of the managers of the Ridge Hospital? Daniel Opoko, TV3 News.
Meanwhile, management of the hospital has debunked accusations that cleaners and other staff of the hospital will be laid off after moving into the new facility. The hospital has hinted of outsourcing the cleaning services and would compel the private cleaning company to absorb the hospital staff who might be affected.
Already, the cleaning staff at the hospital who declined speaking on camera expressed fear they would be laid off. The hospital has more than 60 cleaners and security officers who maintain the running of the facility. The aggrieved cleaning staff are worried if they are laid off, their entitlements and packages would be affected. Currently, the hospital spends more than 50,000 cedis a month on detergents and other items for cleaning. According to the management, a private company has assured to spend 36,000 cedis to help clean the new facility. For that reason, management has hinted of outsourcing the cleaning department to a private company. Director of the Medical Services, Dr. Thomas Anaba, is of the view outsourcing the facility would help sustain the lifespan of the hospital.
We have what we call a waste management plant, whereby all our garbage would go to that plant. It gets disinfected, then it is compacted into a very small piece volume. And we need to move some staff. So we've moved some of the cleaners. We are moving some of the cleaners there if we are allowed to outsource. And we've even submitted their names, such groups of people, their names to our mother agency to get clearance for such people to be permanent staff of the facility.
He again assured that affected staff would receive their packages and other entitlements.
I can't guarantee that some will be laid off. It is our prayer that the people who will be left will just be few. The companies coming should understand, at least also trade something with us to try to comfort the staff that have been working with us for some time.